Hello, my name is Paula Thompson and I am a senior level student in the traditional nursing program here at Nebraska Methodist College, and this is my capstone presentation. The public issue topic that I chose was affording management of childhood diabetes. Childhood diabetes is on the rise in Nebraska, and one of the biggest factors that leads to this is the fact that childhood obesity rates are also on the rise. In Douglas County alone, the childhood obesity rate is at 23%, which is higher than the national average of 18%. The average amount of money spent in managing diabetes is around $16,725 per year. Most of the expenses that are added into that are hospitalizations, paying for medications that are treating complications of diabetes, medicine and supplies used in managing diabetes such as insulin and syringes, and overall going to doctor's appointments. Insulin is a huge issue that makes affording managing childhood diabetes hard. Insulin is just so expensive now. What a bottle of Humalog used to cost $24 in 1995, and in 2019, that exact same bottle now costs up to $275. This is why this needs to be discussed, because if you're not making the best money or you don't have the best health insurance, managing diabetes is hard, and even more hard if this isn't a child, because the parents are the ones who have to pay for this on top of taking care of a child. So this is why I feel this topic needs to be discussed. I chose this topic because of something I experienced during a clinical rotation. I was doing health screenings at a middle school, and a student came in to check her glucose levels that were extremely high. So she gave herself her insulin, and then she recapped her syringe and put it back in her designated box with her personal diabetes supplies in it. I asked the nurse, was this common? And she said, unfortunately, it's more common than people think, because families who can't afford to constantly pay for new supplies and insulin have to make it stretch. And sometimes these kids have to reuse their syringes. And that is what made me so much more interested in this topic. As an educated citizen, I'll be a reflective individual by taking responsibilities for my actions. I can be an effective communicator by properly communicating with patients and making connections. And I will be a change agent by doing my best and using my knowledge to help make a difference in someone's life, whether it's an individual person, something in the hospital, or in the community itself. The educated citizen criteria is going to help me be a successful nurse. The first experience that I'd like to discuss is an effective communicator experience I had during my sophomore year. I was taking my Spanish minor, and we were volunteering at the health window clinic at the Mexican consulate. We did glucose checks, blood pressure checks, and height and weight checks. We discussed what normal level should be to the patients we cared for, and then we also discussed changes that they can make in their own lives to help get levels back to normal and keep them normal. We discussed dieting, we discussed exercise, and we just discussed the importance of seeing a doctor on a normal basis for checkups. What I learned from this experience is how important it is to try and learn another language. Being in healthcare, you're going to take care of patients of all different cultures, all different backgrounds, and having a second language can be so important in helping care for your patients, because it's breaking down that language barrier. I can use this to address my public issue by using my Spanish to communicate with the Hispanic population that is dealing with childhood diabetes. I can help educate them in doing so in their native tongue, which makes them feel more comfortable and hopefully will make it easier for them to understand. The next experience I'd like to talk about is effective communicator that happened my junior year. I was assigned to a patient that nurses kept saying was difficult, but once I was caring for him, he was not what they made him out to be. He was very nice. We had really good conversations. He joked, and at the end of the experience, he was very grateful that I had taken the time just to hear him out. What I learned from this experience is the importance of communication, and that how it goes such a long way just to listen to your patients and just treat them like they're humans. This experience will help me to address my public issue by making sure I take the time to talk with my patients and communicate to them properly. Diabetes in kids is not an easy topic to discuss, and it can be scary for kids. So taking the time to communicate with them at a level that works for them and educating them in ways that are useful for them will help them in managing their diabetes and being able to understand their disease. The next topic I would like to discuss is my reflective individual experience during my sophomore year or my junior year as well. It was more so the overall experience that I had. I had been assigned nurses who weren't the most welcoming, and I had also been assigned nurses who were very welcoming and, very helpful. They wanted to teach me. They wanted to help walk me through things. They wanted to make sure that I was getting the most out of my clinical experience. What I learned from this is exactly how I want to be when I'm a nurse. I want to be the nurse that, my patients are comfortable talking to. I want to be the nurse that's going to help educate, the next generation of nurses. I don't want to be the nurse that makes the students feel uncomfortable. I don't want to make my coworkers not feel comfortable. I want to come off with the most respect I can to everyone around me, because that's what's going to make the job worth it. That's what's going to make the job easier. How I can use this experience to address my public issue is just to remind myself to be aware of my presence, not only with patients, but with my coworkers. If patients don't feel comfortable with me, they're not going to open up and, discuss with me what their problems are. Diabetes, like I said, again, is complicated, especially in kids, and, being approachable with children is what's going to help me to be able to educate them on their disease so that they can better manage it and make changes they need. If I'm not welcoming, if I'm not approachable, they may not open up to me so that I know what they need as far as education and resources they may need. My next reflective individual experience was during my senior year, and with this experience was just moving all learning to online with no in-person clinicals. It was hard to adjust to this because not having that full picture with a real patient and having real interactions it's hard to get used to. But what I learned from this experience is that being able to adjust to change is important. Not everything is black and white in nursing. There's always going to be, things that happen out of nowhere, and being able to use my critical thinking skills and the knowledge that I've gained from my schooling is going to help me to be the best nurse I can and care for my patients as best as I can. This experience will help me to address my public health issue by reminding myself to welcome change. Diabetes is not an easy disease by any means. It can be hard to manage, and so I'm going to play a major role in educating my patients about it and making sure that I stay up to date with new information and using that information to teach patients about diabetes in a way that's useful for them is going to benefit them in managing their disease. My first change agent experience I'd like to discuss was just when I applied for nursing school. I had never really known what I wanted to do, but I knew I always wanted to do something that was helping people. And so I one day just decided I'm going to apply for nursing school. And when I got accepted to Methodist, I just felt like I had finally figured out what I was going to do with my life. What I learned from this experience was how much I truly want to make a difference in people's lives and how passionate I am for caring for others. I knew nursing school was not going to be easy, but that never stopped me from following my dreams. This experience will help me to address my public issue by just reminding myself why I chose nursing, why I wanted to help people, using my passion to make a difference. I hope that one day with childhood diabetes, where childhood diabetes is concerned, that I can start a clean needle program in schools that don't have the resources, so that the students that do have diabetes in the school can at least have clean needles and supplies while they're in school. My second change agent experience is from my sophomore year, and with this experience, we went and volunteered at a local church in Omaha and helped out with their food pantry. We helped the people who were using the food pantry. We helped them to take their food out to their cars. We got to just have conversations with all kinds of different people. We got to check their blood pressures and discuss the importance of, checking blood pressures and how to keep blood pressure within its normal limits. And it was just an overall great experience with great people. What I learned from it was the importance of community. Community health is so important because that is where you are learning the most about a person. You are learning where they come from. You are learning what resources are available to them. You are learning what resources are not available to them. And with that, you can help to make a difference in making changes so that they are, able to get things and resources become more available to them. How I can use this to address my public issue is getting involved in the community. Throughout my program, I have learned about so many different community places that I can volunteer that help make a difference. There's the mobile diabetes clinic. There are programs within hospitals that are helping fight childhood obesity, which is a huge factor in childhood diabetes. So getting involved in the community is a major way where I can help make a difference when it comes to childhood diabetes. In conclusion, my time at Nebraska Methodist College has set me up for success as not only a nurse, but as an educated citizen. I have learned so much about myself and the things I am capable of. I have had so many wonderful experiences throughout this program, and I have met so many amazing people. I have also been exposed to so many community resources that I will now be able to share with future patients, and hopefully I will be able to get back and help volunteer once I'm just working. I'm so grateful for all the experiences and all the knowledge I have gained from Nebraska Methodist College, and I just can't wait for what the future brings, and I'm ready to make a difference. Thank you so much for listening.